Will democracy survive in the next couple of years?
And essentially, we are the same.
And there are so many needs that Minnesota has.
What people are saying they need right now.
Access to democracy is made possible by donations from the following organizations. Thomson Reuters, a global company with expertise and insight to unravel complex situations in the areas of law, tax, compliance, government, and media. Their worldwide network of journalists and editors keep customers up to speed on relevant global events. Thomson Reuters, the Answer Company. Crutchfield Dermatology, a full-service treatment center in Medi-Spa in Eagan. Their goal is to help you look good and feel great with beautiful skin. With service built around courtesy, dignity, and respect, Mayo-trained Dr. Charles Crutchfield personally treats each patient and is acknowledged as one of the nation's best physicians. Firefly Credit Union, with locations throughout the Twin Cities, has proudly served Minnesotans since 1925. Firefly guides its members forward by delivering customized financial solutions to improve their lives in all aspects of banking. Firefly Credit Union, they light the way with life illuminated. Edina Eye, Physicians and Surgeons, a division of Twin Cities Eye Consultants, has proudly served the Twin Cities for more than 55 years. Now in 7 convenient locations. Using the most advanced technology combined with human touch, Edina Eye offers comprehensive services but dedicated specialists committed to excellence with innovative procedures and expertise for the most advanced eye care.
Welcome to Access to Democracy. We're in our 22nd year of bringing you influential and interesting guests with informative and thoughtful interviews. And today, I'm Bill Raker, the guest host for this edition of the program. Our guest is Amanda Vickstrom with the Minnesota Elder Justice Center. Welcome, Amanda.
Thank you. Nice to be here.
Amanda, we're delighted and excited to have you on Access to Democracy. What is the Elder Justice Center here in Minnesota, and what does it do?
Sure. Thanks for having me. Happy to have an opportunity to talk about the Minnesota Elder Justice Center, our work, and elder abuse more broadly. The Minnesota Elder Justice Center is a nonprofit, and we're a statewide organization, and we work to prevent and alleviate elder abuse, neglect, maltreatment, and financial exploitation. And we do that primarily by offering both direct services to victims or their family members or concerned others. So really working with people as they are struggling or experiencing abuse or neglect, financial exploitation. We work with professionals who work with older adults and train. So elder justice, we can talk about that today. It's really a broad topic. And so we do a lot of training and education around what it means, what things like substitute decision-making and supported decision-making and powers of attorney and sort of all the layered things that perpetrate and perpetuate elder abuse. How do we provide training to those that are working with older adults so that they can do their work better and really have impact in their own communities on addressing elder abuse? And then policy and systems change work. So what changes need to happen at either the community level, the state level, the federal level, to make sure that our policies and systems advance things that support victims, older victims, or advance elder justice initiatives. So really looking at elder justice and elder abuse more broadly. How do we work with both the individual, the community, and the larger system that affects us all?
That's a broad mission, Amanda, and you've been serving as the executive director of the Elder Justice Center since its inception in 2014. And along with that, you have over 20 years of experience working on behalf of victims of domestic and sexual violence and elder abuse. And would also like to mention some other things about you, Amanda, as you've brought this experience into the role that you have. You served as a member of Governor Dayton's consumer work group to address elder abuse in long-term care facilities. And currently you serve as a board member for the Minnesota Leadership Council on Aging. And you hold a Master's of Public Policy degree from the Humphrey School of Public Affairs at the University of Minnesota. So a great organization with a fantastic mission and a really experienced leader in your role there, Amanda. So what brought about the creation of the Elder Justice Center? I mean, how did that happen and why?
Sure. Yeah, it really was a grassroots effort that grew out of other work. You know, we built on the backs and the efforts of prior work that had happened in Minnesota in 2012, 2013. There were several of us working on either domestic violence, elder abuse issues. I was working at a county level at that time where we were really starting to hear about elder abuse more from, frankly, constituents and callers, people needing services, and decided to join efforts. I was an Anoka County initiative originally, joining efforts with what was called the Vulnerable Adult Justice Project at the time. And that was a policy group led by Iris Freeman, and out of housed at the time, it was William Mitchell College of Law. And it was a group of, frankly, anybody who was working, who was interested in vulnerable adult law and policy from various fields, adult protection, long-term care, consumers, that were meeting once a month to try and make policy changes. And a few of us got together and said, we're seeing this issue rise on the service end. We're seeing a need for more training around elder abuse. We're wanting policy advancements. There was no central place for this work to be done. And so at the time, we formed this little coalition called the Safe Elders Stop Abuse and Financial Exploitation Elders Coalition. And we made a video, and we worked with Twin Cities Public Television, and we made a toolkit. And we thought, we're gonna provide this education, this education around elder abuse, which was really not talked about and still isn't talked about as much. And in many ways is sort of where domestic violence services were, 15, 20 years ago. We just started talking about the issue. And then we thought we'd go back to sort of our daily work, me in a county attorney's office, Iris and others in their other, the policy world. But the phone kept ringing, and we knew for people really asking for help after they heard about this. And we realized we needed a system to really address this. We needed an organization to hold this work. And so several of us started forming the Minnesota Elder Justice Center. So it was this sort of right time, a lot of great people and some seed money at the table. So initially we had a mission, a 501c3 charter, got our nonprofit status, and 18 months of funding. And we thought, we'll see what happens and see if we can build it. We knew that we would have to provide direct services because the phone rang. And so people found us and needed help. And so that was critical for me in particular. If the phone is going to ring and I don't have any place to send people to sort of walk them through these situations, we had to build it. And so we really built from that initial board, built a strategic plan around both the services, but also the training. And then how do you make long-term lasting change? It's through policy. So really built around those efforts.
Well, the inception of the center story that you just told is really inspiring, and you have identified the need for the kinds of services that the center provides. But let's frame it up a little bit. Just can you tell us how prevalent elder abuse is here in Minnesota, and what are some of the factors that contribute to the elder abuse situations that you deal with?
Sure. National research tells us that about 1 in 10 older adults will be a victim of abuse, neglect, financial exploitation at some point during their life. And that as we age and as we experience sometimes some cognitive or physical limitations, our risk goes up. So with a cognitive impairment, the risk goes to 1 in 5. And we see that along our spectrum of callers as well. So we have this sort of 1 in 10, knowing 1 in 10 older adults will experience this, and 1 in 5 when there's some sort of cognitive impairment. We also know that older adults lose at least $3 billion a year to financial exploitation. And so someone taking advantage of them or misusing a power of attorney or a scam or a loved one taking the money. And that's never just about money, because what we also know with older victims is that they experience something called polyvictimization. It's a fancy term, we use in the field, but it really means experiencing more than one type of abuse at a time. So when someone is having a family member take money from them, misuse a power of attorney, they're very likely also experiencing some sort of emotional abuse, physical abuse, maltreatment, some other harm or abuse that is going along with it. And some other, I think, important statistics are that about 2/3 of the time, the perpetrator of elder abuse is someone that victim knows. There's a relationship of trust. So it's a family member or a friend or someone who is in some sort of caregiving position of trust with that person. I mean, we hear a lot about sort of the fraud and the scams that happen from strangers, which absolutely happen. And we hear a lot about kind of the caregiving nursing home maltreatment also happens. But what we don't like to talk about as much is that your perpetrators are frankly sitting around your Thanksgiving Day table, as is the case with many child abuse perpetrations. So it's really, and we find that similarly true with the clients that we serve. In Minnesota, we have a formal reporting structure where we know that around 57,000 reports of what's called vulnerable adult abuse occur each year. Those are not all substantiated and they're not all older adults, but about 60% of those 53,000, 57,000 reports, it changes every year, are individuals over 60. So we do know that it's a widespread issue. It's also really underfunded in terms of research. So we don't have as much data and as robust data as we would like to have in terms of the data that the research that's happening even at a national level. So how do we even raise the issue enough so that we get the same kind of research and data that child protection, domestic violence, other forms of harm receive? And as someone who's worked in victim services for a long time, I never want to pit one victim over another. I want us all to have, equal access to both services and research. So,
well, you mentioned funding and resources. Can you tell us a little bit about how the Elder Justice Center is funded and how it's staffed? What kind of professionals you have working with you in the organization?
Yes, I'm happy to do that. We have just a great staff and board, and I'm really proud that we have the team that we have. We started in 2014 with just myself initially as an employee, and we now will be bringing on our 9th staff person in a few weeks here. And so we have grown. We're a statewide organization, and we're funded in like many nonprofits in a variety of ways. We try and we like diversification of our funding sources so that we're never too heavily reliant on one. We do receive some federal funding through our state, through the Office of Justice Programs. It's called VOCA, Victims of Crime Act funding. So we receive some of our direct service funding through some state and federal grants. And that allows us to both provide advocacy and support to victims, and also some legal representation to victims. We do have some great foundation partners, some of the main kind of foundation partners in Minnesota that fund aging work or victim services work. We're lucky enough to be able to partner with them. Allianz, Otto Bremer, so sort of the kind of traditional in the nonprofit world, the foundation funders. And then we have individual funding as well. And so people that we've been able to, whether it's $5 or more, if we can, we're really grateful for anybody that feels like we're doing valuable work that they want to invest in. So we operate with about $1 million budget this year, and that's spread across nine staff, and we have one physical office location, but we have some staff working in Greater Minnesota too, because we are a statewide organization, and that's really critical to make sure that we have staff located in the communities that we serve.
Well, with the staffing that you have, how many cases can you actively work on at one time? And how many do you have going on right now, if I may ask?
Yeah, sure. So yeah, we have about 9 staff, and they don't all do what we call direct service work, and that's working with clients. So I think you'd asked a little bit about the experience. We do have we have those of us that who have backgrounds in nonprofit management and victim services like myself. We have a couple of people with backgrounds in elder law, and we have one that actually provides free legal representation in certain limited cases to older victims right now on staff, and we're bringing on a second staff very soon. We have 2 staff who have a background in kind of long time working with victim advocacy, have done a lot of advocacy work with underserved populations or victims of violence, victims of crime, that can provide that ongoing support to people experiencing victimization. We have staff with expertise in public health that can look at sort of prevention and impact of our work, and some staff with expertise in training. So how do we actually deliver training, especially in the era of COVID, in a way that's meaningful? And so we serve about 600. I think last year was 650 victims of abuse, neglect, financial exploitation, and those are kind of varying capacities. So some might have been a 30-minute phone call, and some might have been full legal representation. And so we do have a helpline that people can call free of charge anytime to speak to an advocate. And that service sort of ranges on what the victim needs. So how long we work with somebody is really what the victim needs. Sometimes it might be a resource or referral. Sometimes it might need a half an hour to talk them through what they're doing. More frequently, it's a little bit longer to kind of untangle the abuse that one might be experiencing, and how do we help get them to where they need to be if it's not us. We don't like to just give people phone numbers and have them call away. That isn't victim-centered, and it's not helpful for somebody in crisis. So if we find that we need to kind of hand somebody off to, whether it's an adult protection system or a social worker or public health, we'd rather do what we call a warm referral and try and get somebody to the next place that's going to provide them the help that they need, if it's not us, rather than just a list of phone numbers.
Well, can you tell us the phone number that someone should call if they need your assistance?
Absolutely.
And we'll try to get that into the screen as well, but give us the number.
Sure, it's 651-440-9300. And if it's not picked up, you can leave a message and somebody will get back to you. We're not a hotline, but we are a helpline. So it's not staffed 24 hours a day. If someone's having an emergency, they should certainly call 911, but a trained advocate will get back to them. And it's confidential. Victim services is really built and rooted in confidentiality. And so it's whatever that person needs.
Well, we'll make sure that number gets some further mention. You used the term COVID, and seems like everything today in the media is about COVID. What are some of the COVID virus-related challenges that have emerged, and what might be some of the lasting effects of this on you and the services that the Elder Justice Center offers?
Yeah, I mean, I imagine there's not an industry or an individual that hasn't been in some way touched by COVID. And for us, when our clientele that we work with are disproportionately impacted by COVID because of age or vulnerability. And so I think what we have seen over the past 11 months or so has changed. Initially, we were seeing a pretty severe drop in our calls and requests for services in March and April. And I think that was consistent. I know that was consistent along with other helplines, with our adult protection reporting system. Our friends at Alzheimer's Association and AARP were experiencing the same thing, where I think everybody was just hunkered down, and we were really worried that people weren't reaching out for help because we didn't think the abuse just stopped. And that was the case. The calls kind of in April started coming, and we actually ended the year with a 19% increase in our calls in 2020 versus 2019. So the types of things that we were hearing were, for us, older adults having to kind of shelter in place with abusive family members. So that was how to navigate that, and some of the tools that we would use to help get an abusive family member out of a home were not necessarily available to us initially during COVID. When some of the eviction protections, I know there were exceptions for safety, but it was harder. So that was certainly a concern. A lot of our older adults that we work with who also are more vulnerable or have further limitations. I mean, when we say older adults, by a federal kind of grant statute, that's like 50 plus. Well, people are very different. It's not one group. 50 to 90 is not one group, and lived experiences and socioeconomic status and there are barriers in that. So you could have a 55-year-old with very different needs and issues than a 90-year-old, and it's not one group is what I'm trying to say. There's many different needs within an older adult subset. We lump it all together frequently as one, and that's another issue, but it's not just one. There's many different subsets, but we really saw older adults who had cognitive limitations or who really required assistance from others in their own homes being more isolated. When you don't have Meals on Wheels coming in to deliver that meal, or you don't see the people who are coming into your house to help you, you really are isolated in terms of asking for help, which just allowed, abuse to either occur without feeling like they could get help, or unsure of what services were still available because we were all, in new ways, working in new ways. There was certainly with COVID other concerns around access in our long-term care facilities. So ombudsmen or advocates unable to get into long-term care facilities to assist when there was suspected maltreatment. I mean, that stopped. Those in-person services stopped for many months. And that was very concerning, because when you don't have kind of family, friends, or ombudsman available to be additional eyes and ears on the ground, you're really relying solely on long-term care staff, who by and large are great and helpful. But when if maltreatment is occurring, there's no other extra layer of kind of checks and balances for someone who's living in a long-term care facility. So access and isolation were huge concerns. And I think now what we're talking about is vaccine access and equity, and how do we make sure those who need the vaccine, those who are eligible vaccine, can get the vaccine, and how are we prioritizing that? And how do we make sure people who don't live in a long-term care facility or have limited technology access and the inability to drive, how do we get somebody from their home to make sure they get their vaccine? So there are many sort of COVID-related issues that has impacted how we do our work and the kinds of things that clients are needing from us to think about on top of the victimization that they may be experiencing.
Well, Amanda, it's terrific to see the kinds of activities, the kinds of things that your organization is doing, and with such a wide-ranging group of needs that you're trying to serve and the kinds of services that you provide. Are there other organizations or agencies that the Elder Justice Center partners with to fulfill the mission?
Absolutely. So we really sort of live between the aging world and the victim services world. So we're connected with domestic violence agencies, sexual violence agencies, victim service providers, but we're also working with our partners at the Alzheimer's Association, who can really talk and know a lot about how to work with an individual with a dementia or a cognitive impairment. So we will partner with them. We partner with AARP, especially when we're talking about fraud, consumer fraud, scams, financial exploitation, and a lot of policy efforts too, things at the legislature. We're certainly going to partner with long-term care providers. We want a good working relationship, and they are a valuable part of our our system here in Minnesota to care for older adults. And so it's, where can we partner? How can we train? How can we help clients that they have who are living in their own facility and facing abuse, financial exploitation from a family member? We partner a lot with the state's adult protection system. They're a really critical part of ensuring safety for older adults. So adult protection is in every county in Minnesota. So all the county APS agencies, and then the state's adult protection system, they operate the Minnesota Adult Abuse Reporting Center. And that is the kind of central entry point for someone making an official adult protection report. Someone is experiencing abuse or neglect and they want to actually report it. That's who they report it to. So we don't think that we necessarily have all of the answers. We are filling a very important gap in our current system, where we're making sure that older adults, regardless of vulnerability, or those that are kind of fall through the cracks with adult protection, have a place to go where they can get confidential help in understanding the system and legal representation and training. But we can't be everything to everybody and don't want to. And we want to partner and rely on our friends whenever possible. How can we work together to get to access to justice for older adults?
Well, this is a really informative, interesting, and very critical conversation we're having, Amanda. But let's wrap up with a brief answer to this question. The people over 65 in Minnesota will soon outnumber the school-age children. So with the increasing number of elderly population, how do you see the role of the Justice Center changing or expanding? With a very brief answer to that.
I think that's one of the reasons that we knew we needed to build the center in 2004. We saw, the need in terms of ensuring that there's services, education, and a real concerted effort around policy changes that broadly address older adults. I would say for us, elder justice, it's not just about the abuse, neglect, financial exploitation, but what are other forms of maltreatment or injustices that an older adult might be facing. And so we are willing to explore what that means as society changes. But I think it's helping to ensure just what you're saying, that we have that all Minnesotans sort of have access to services and justice regardless of the age, and the proper amount of focus in terms of funding and policies. So it's really just keeping aging at the forefront, or putting it at the forefront if it's not there, making sure we're including it. So I would just encourage anybody who finds themselves in a situation where they are concerned about a loved one or experiencing abuse, neglect, or financial exploitation, to feel free to give us a call and reach out for help. It is a confidential victim services line. So I think sometimes people feel assured that they can get the information that they need without actually, as someone said to me once, kind of ringing that bell and making it official. We can listen and just walk somebody through. So you can feel free to call us at 651-440-9300, and our work is just beginning. So we really look forward to people partnering with us. And if you have great ideas of work we should be doing, we're a pretty open door in terms of coming to have conversations. We welcome that.
Well, thank you so much, Amanda. Our guest today has been Amanda Vickstrom, who's the Executive Director of the Minnesota Elder Justice Center.
Thank you very much. Thanks for having me on today.